Hello friends, I am Dr. Shalabh Aggarwal, Senior Consultant Urologist at CK Birla Hospital, Gurgaon. So today I would be talking about BPH and its management. BPH is a very common disease and it is a disease of elderly population. That means it starts in people more than 50 years of age. It is not a disease of young people. So what is BPH, or for that matter, what is prostate? So if we look at our lower urinary system, this is the urinary bladder, right? Below the urinary bladder, there is an opening from where a tube starts and goes all the way out to the penis. So just below the bladder sits the prostate, right? So the urine tube passes through the prostate. With age, there are certain changes in the bladder and changes in the prostate, as a result of which this tube starts being obstructed by the enlarged prostate, right? So initially the obstruction is low, then the obstruction becomes more severe and the tube becomes further narrow. What are the symptoms of BPH? So BPH can have different spectrum of symptoms. In each patient, the symptoms, they tend to be different from each other, and the progression, rate of progression, severity again is different from each person. Again, a very common thing in people's mind that prostate size is the one that causes symptoms or is related to the symptom. So mind it that prostate size in BPH is not related directly to the symptoms. Somebody can have a very large prostate and very minimal symptoms, or somebody might have a very small prostate but a very severe symptoms. So again, the management is also dependent on the symptoms of the prostate. It is not a management which is based on the size of the prostate, but the aim is to relieve the symptoms and to give a better quality of life. So what are the common symptoms of prostate or BPH? So due to obstruction of the urine tract, some people might experience decrease in urine flow. The flow might be intermittent. They might have to strain to empty their bladder. Even after passing urine, the bladder might not be completely empty, or they might find it difficult to start the urination, what is known as hesitancy. Along with the changes in the prostate, there are changes in the bladder also, which can give rise to various kinds of symptoms like urgency or urge incontinence, wherein some people might leak urine even before they reach the washroom. There might be increased frequency of urination during the day or night. Sometimes there might be a bit burning in urinations. So these are the usual symptoms of BPH. Mind it, these symptoms are what is known as lower urinary tract symptoms, and do not particularly refer that this is because of the BPH. These symptoms can also be there in other diseases of the urinary tract. So how does one diagnose BPH? Diagnosis of BPH is mainly a clinical diagnosis based on the history and examination. Further, tests are done to rule out other causes which might be contributing to these kind of symptoms. What are the other causes? Like bladder stones, there might be cancer in the prostate, for which a PSA can be helpful, rectal examination can be helpful. There might be narrowing of the urine tube, what is known as stricture of urethra. Sometimes there may be only foreskin problems like phimosis or chronic prostatitis, which can again give rise to these kind of symptoms. Or in some people, there might be bladder weakness per se, neurogenic bladder. So these are the few common problems which can again mimic the symptoms of BPH. So how does one treat BPH? So as I mentioned, the treatment is based mainly on improving the quality of life and symptom control. The changes in the prostate or BPH or changes in the bladder, these are ongoing process which are related to the age and physical changes in the body, right? And any kind of drug cannot just stop these changes. So again, as I mentioned, the aim of the treatment is to give a better quality of life. So for that, two kind of treatments are there. One is the medical therapy and second is the surgical therapy. So in those patients who have mild to moderate kind of symptoms, most of these patients can be very well controlled on medical therapy. Again, in medical therapy, medicines are not something which is single medicine for every patient. Every patient will have to be given different set of medicines so that his symptoms are addressed, right? These medicines are usually to be taken for a long time. Fortunately, the dosing of these medicines is very easy, like once a day, and they don't have any long-term side effects, and their efficacy is also maintained in the long term. But in those patients whom there are severe symptoms or symptoms are not being controlled on medicines, or they were on medicines, but now the symptoms are getting worse. These are the patients who would require surgical therapy for the prostate. Besides those patients who have developed complications of the BPH like recurrent infections, red blood in urine, recurrent hematuria, or a bladder stone, or there is accumulation of urine in the bladder and the kidney, what is known as chronic retention, or they have recurrent episodes of acute urine retention. So these are the patients who would require surgery upfront to address their symptoms, and medical therapy would not be a good choice in these kind of patients. So now again, there is usually a fear that the surgery might not be able to address your symptoms. So partially this is correct because the changes in the urine tract have happened over many years. So it is very irrational to expect that a surgery is done and all the symptoms, they will disappear overnight. After surgery, once the prostate, the part of the prostate which is obstructing the urine flow, that is removed, immediately there is improvement in urine flow, and slowly the other symptoms also they tend to revert. So usually it might take about 3 to 6 months time after surgery for one to experience that there is a significant improvement post-surgery. But yes, in case it is required, then this is the right treatment and much better than a medical therapy in those cases where this is required. So it is important to remember that BPH is a disease of aging male and usually happens after more than 50 years of age. It can be treated both medically and surgically depending on the symptoms, not size of the prostate. One should get a proper evaluation and timely consultations if they are having significant symptoms, or if they feel that their quality of life due to urine problems is not normal, they should consult a urologist and get a proper help and proper evaluation and a proper treatment. Thank you.